Good afternoon. The Senate Finance Committee is now in session, and we're going to get started with Senate Bill 27, Senator Augustine. If you want to introduce your bill, you're on now, Senator.
Thank you, Chair Kelly and members of the committee. Senator Malcolm Augustine here presenting Senate Bill 27, Dementia Services Act of 2022. Colleagues, this bill repeals the termination date for the Virginia Jones Alzheimer's Disease and Related Disorders Council and alters its staffing and reporting requirements. It establishes a full-time director of dementia services coordination within the Maryland Department of Health, responsible for staffing and managing the council, upon which I sit as our Senate representative. It implements the state plan on Alzheimer's disease and related disorders. It identifies and applies for grants, coordinates with other state agencies, assesses and analyzes statewide data related to dementia, while supporting dementia-specific training and outreach efforts. Colleagues, 110,000 Marylanders are living with Alzheimer's or another form of dementia. About 1 out of 9 of our state's seniors, and that number is expected to grow. In 2020, Maryland spent $1.2 billion in Medicaid costs on Alzheimer's and other dementia. Those costs are expected to increase significantly by as much as 25% by 2025. But we don't have anyone who's really coordinating the efforts around that. The truth of the matter is that we have been having some success in the United States with decreasing of heart disease, for example, down 7% over the last decade with regard to deaths. But that number has increased by 145% with regard to Alzheimer's. We need to have a coordinator in order to who's paying attention to this at all times. Now, what we know, colleagues, is that we've got some good news, though. Even though this is all the issues and the concerns that we have around cognitive health and dementia-related services in Maryland, the good news is that the state does have a Center for Chronic Disease Prevention and Control that's led by Christy Peer, who I've worked with successfully on a variety of matters within the Department of Health. This is the home of the council, and it's the perfect home for this director. Indeed, it is the home of a similar position for the person who directs diabetes for our state, which is another chronic disease that obviously is a very important to our state that we manage properly. Now, this type of role currently is in place in 15 other states, including Virginia, who the coordinator you will hear from today, the person who handles this for the state of Virginia. I will share with you that as a council, we were charged and have updated our plan, and it is in review right now. Within that plan, our number one recommendation was, and priority, was that we have this position filled of the director. Now, when we get this position filled with the director, that director then will be responsible for building capacity, for coordinating across these state agencies, identifying efficiencies, securing funding sources that can support the effort outlined in the state plan. With that in mind, colleagues, I ask for a favorable report on Senate Bill 27.
Thank you. Are there any questions? Before I call on the next witness, I would just like to welcome her back to the Senate of Maryland. A lot of us got to serve with her for a long time. She did very good work, and the original bill that we are about to bless for reactivation was an example of her very good work, Senator Verna Jones Rodwell. Okay, and you're on. For the other witnesses, we're giving 2 minutes each because we've got so many bills. It takes longer doing things virtually, and then we've got a voting session. Thank you.
Yes, thank you. Thank you, Chairwoman Kelly. Thank you so much for your kind words. Good afternoon. My name is Verna Jones Rodwell. I'm a former senator, as the chairwoman had acknowledged. And I would just like to say thank you to the esteemed members of the Senate Finance Committee for this opportunity this afternoon. It is with sincere gratitude that I thank Senator Augustine for sponsoring this bill and for his commitment to working with individuals that are impacted by this disease. And it's not just me, but it's also those that are affected by or will be affected by Alzheimer's and related dementias. So I just want to say thank you. And I also want to acknowledge Madam Chair for her outstanding work in laying the foundation in 2010 as a member of the work group that really had the foresight to make sure that we had the coordination, or at least began the coordination in the state, as well as Senator Hayes and others for their loving kindness that they've extended to their loved ones that are impacted by this devastating disease. As I was reading over my notes, I started getting a little weepy, and I said, now, why am I weepy? And then I started thinking about my story. Alzheimer's has had an impact on my life for 56 years. I'm 66 years old now. So most of my life, it has been a part of my life. However, in early 1992, after living with early onset of dementia for 35 years, our family has seen the progression of the disease physically, and we had seen the devastation of memory loss of a woman who had taken care of a family business for decades. And we saw her develop into someone who had forgotten how to swallow her own saliva. So we, as a family, made sure that we were able to put in place, by raising money at her funeral, a mechanism to do outreach for the African American community in Baltimore. And from that, we have been able to grow with my father having passed in 2004 from vascular dementia, another dementia which is running havoc in all of our communities. We have been able to establish a program that is in its 18th year. And that program mirrors other programs that are going on around the state. And it is now time that we take it to another level so that every individual and every community throughout the state has opportunity to take advantage of the lessons that others have had with Alzheimer's and related dementias. We cannot take anything for granted. We have to make sure that we stay vigilant, because this disease, we hear about it now more, but we don't really see the impact of it. So by having a professional individual to come in and do the coordination locally, statewide, and nationally, Maryland will again be at the forefront of making sure that we address the needs of our communities throughout the state. So it is with this vigor and commitment, as the commitment that so many of you have, I would ask you to render a favorable report on Senate Bill 27.
Thanks so very much. A little over time. And I believe you've been so clear that I don't think there ought to be any questions about why or the rationale. So if members are okay, we're going to move on to our next.
Madam Chair, can I just say a brief statement, not a question? I just want to acknowledge Senator Jones' contributions to me. It was in 1998 in her campaign of Hope, Help, and Healing that gave me my very first introduction to politics as we know it, and especially advocating on an issue so important and dear to me because of my grandmother's current situation. I thank you for your advocacy around this issue of Alzheimer's.
Thank you.
Okay, thank you. All right, with that, we're going to Ann Nelson from the Alzheimer's Association National Capital Area. Okay. She did it.
Good afternoon, everyone. Chair Kelly and Vice Chair Feldman. My name is Anna Nelson, and I'm Vice President of Programs and Services at the Alzheimer's Association National Capital Area Chapter. Thank you for this opportunity to testify today in support of Senate Bill 27. This legislation provides funding for a Director of Dementia Services Coordination at the Maryland Department of Health. I want to start my testimony by thanking the bill's sponsor, Senator Augustine, for his leadership. He represents dementia-friendly Prince George's County. Prince George's County Department of Family Services received a federal dementia capable grant to provide support for caregivers of people living with Alzheimer's and other forms of dementia. The Alzheimer's Association National Capital Area Chapter is pleased to partner with the Department of Family Services in support of this grant. Other Maryland counties with coordinated efforts include Montgomery County and Baltimore County. However, as mentioned before, there is not a state position to coordinate and facilitate communication relating to dementia services. We heard the terrible numbers, right? Over 110,000 Marylanders living with this disease, over 300,000 family caregivers. In 2020, we heard as well, Maryland spent $1.2 billion in Medicare on this disease. A state director to address dementia is needed. This position could also apply for grants. In fact, it could be a revenue positive for the state. We must build an infrastructure to address dementia statewide. Maryland must join the many states that have a dementia-specific position in state government. This position would coordinate services and activities at the state and local agencies. I urge a favorable report on this legislation.
Thank you very much for your testimony. I don't see any hands raised, so we're going next to Quincy Samus.
Thank you so much for the opportunity to present. I'm pleased to testify in support of Senate Bill 27, the Dementia Services Act. I'm a health services researcher at Johns Hopkins School of Medicine with nearly 2 decades of experience conducting Alzheimer's disease and related dementia research. I've served as the chair for the Virginia Jones ADRD Council since 2019, having been raised by my grandparents on the Eastern Shore of Maryland, and perhaps like many of you, having witnessed firsthand the impact of ADRD on loved ones. The need to do better, to reduce risk, and to improve care is personal. ADRDs represent an urgent, high burden, and high cost public health crisis in Maryland. Our research at Johns Hopkins shows that unmet dementia-related needs among Marylanders are very common, but often go unevaluated and unmet, leading to excesses in poor outcomes, higher healthcare costs. ADRDs are actually the most expensive chronic condition in the US, surpassing heart disease and cancer. You've heard the numbers in terms of Maryland's Medicaid spending. And this will increase, is expected to increase by 25% from 2020 to 2025. Effective interventions, including those developed here in Maryland, are available, yet are not well coordinated or widely accessible. Further, best available research evidence from all over the world suggests that the risk of dementia could be reduced by up to 35% by modifying risk factors over the life course. This bill establishes a full-time director of dementia services position in Maryland, Maryland's Department of Health, which in my view is a critical step for building on and coordinating existing efforts across Maryland. Supporting a state-level champion for ADRD and brain health comes at a critical time, as you've heard, as new national bipartisan infrastructure and research funding opportunities are available at unprecedented levels. The position will be key for the successful implementation of the forthcoming 4-year state plan on Alzheimer's disease and related dementias that has recently been updated by the council. I urge a favorable report as a commitment to the long-term health and well-being of Marylanders and an investment in the infrastructure to ensure effective and equitable care is available. Thank you very much.
Thank you. Next, we're going to our neighboring state, Virginia, to hear from George Worthington, who's with the Virginia Department of Aging and Rehabilitative Services. And so you're on.
Thank you, Madam Chair, for the opportunity to testify in favor of SB 27. I'm the Dementia Services Coordinator at the Department for Aging and Rehabilitative Services in Virginia. In our state's first dementia state plan, released in 2011, the first recommendation was to create a position and obtain specific funding to hire a full-time Dementia Services Coordinator, or DSC, to coordinate the services provided to persons with dementia, working in conjunction with the Virginia Alzheimer's Disease and Related Disorders Commission. The plan envisioned the role of the DSC to include disseminating information on services to individuals living with dementia and caregivers, establishing a strategy to link and coordinate the services of state agencies, service providers, advocacy groups, and the Aging Network, coordinating and supporting the Alzheimer's Commission, promoting services for all stages and types of dementia, and ensuring that the Aging Network is dementia capable. Virginia's General Assembly included $100,000 in funding for this position starting July 1, 2013. The initial and ongoing investment of state funding for the DSC has translated into millions of dollars in federal grants and better targeted state investments in coordinated and evidence-based programs. The DSC has been instrumental in driving 2 4-yearly updates to the Dementia State Plan to reflect emerging priorities. The DSC has secured and administered federal grant funds totaling over $1.25 million from the Administration for Community Living. Partnerships with the private sector established under these projects received a further $2 million in ACL grants. The DSC has been instrumental in helping secure a current BOLD Act grant from the CDC of close to $1 million. This funding has helped lay the groundwork for Virginia's dementia capability by implementing training for healthcare professionals, first responders, and direct support staff, integrating dementia awareness into the case management system used by the Aging Network, and implementing an evidence-based care coordination program for people with dementia, as well as other caregiver supports. The DSC has also represented the voice and needs of people with dementia and caregivers across state agencies and systems, and has forged strong partnerships with the Alzheimer's Association. I urge a favorable report for this bill. Thank you.
Thank you very much. We're going next to Eric Kolgemara from the Alzheimer's Association Government Affairs Division.
Hi, Chair Kelly. I'm actually just here as an informational witness in case there are questions.
Okay, and I don't see any. I think the speakers have all done such a good job that I'd be surprised if anybody wanted to vote against this good bill. So I think we should move it along as quickly as we can because the need is serious. Okay, I see no hands raised. Thank you. That's the end of the testimony today, the oral testimony on this bill. And we're going to move now to Senate Bill 263, Senator Bidle, Health, Food Services, Facilities, Beverage Options with Children's Meals.
Thank you, Madam Chair. And thank you, Chair Kelly, Vice Chair Feldman, and members of the Finance Committee for the hearing on Senate Bill 263. So Senate Bill 263 is an attempt to reduce the number of sugary drinks that children are having access to in a way that when you have a children's meal in a restaurant, that the first choices will not be sugary drinks. The first choices will be milk, water, and 100% fruit juices. So it's a common sense approach to help children and families make healthier choices. It's already happened in some counties. This would be a statewide bill. I've been working with the American Heart Association on the bill. So it's just important. I think maybe a lot of families don't even realize the amount of sugar that's in sugary drinks with corn syrup and sugar in general. So this is just a way to really put the healthy drinks out in front when they order a meal. So it would be water that's unflavored or unsweetened or uncarbonated, whole or non-fat or low-fat pasteurized cow milk with no added flavors, a non-dairy beverage that's nutritionally equivalent to cow's milk, or a 6 ounce or less that consists of 100% fruit juice or vegetable juice or a combination of fruit and vegetable juice. So I think this is important for the health of our children as we see obesity is still such a problem with our kids, and heart disease is the result of obesity. And I'd like to ask for your favorable support on Senate Bill 263.
Thank
Madam Chair, I
you.
do have a panel. Laura Hale, Ramey Eck, and Natasha Mayhew.
Okay, that's fine. We have them all listed. So let's see. Can I start with Laura Hale?
Thank you, Chair Kelly, and thank you, Senator Bidle, for your sponsorship of this really important legislation. Good afternoon. My name is Laura Hale. I'm the Director of Government Relations with the American Heart Association, and we offer our strong support for Senate Bill 263. We have seen the introduction of having a healthy beverage be the default beverage for kids' meals being an amazing step to making sure that our kids are healthy. As a new mom myself, I've seen, and now that she's old enough to go to restaurants and get a drink, not having to have the fight about, oh, is it a soda, is it a water, having that be the default beverage makes all parents' lives easier to make sure that that's the easy first choice. But also, if parents so choose, they can choose to order a soda for their child, but it just makes it so that that decision is a healthy one to start with. But they can ultimately make the decision to say, no, I want to order a soda for my child today. We've really seen this to our neighbor Delaware has passed this legislation. It has been in effect. Baltimore City, who's here today, has had this in effect for quite a while. Prince George's County recently passed this legislation and will be implementing, and Montgomery County is currently considering this as well. So we've really seen that this has been something that's a great positive across the state. And the science shows us that as we've laid this out, as this legislation is put forward, that this is really the setup, including 6 ounces of fruit juice, water, or milk is really the way to go. And the science shows us that this works very well. So thank you all so much for my time today. And this is our strong support for SB 263. Thank you.
Thank you very much. We're going next to Renee Eck from the Maryland Public Health Association.
Good afternoon, Chair Kelly and Vice Chair Feldman and members of the Finance Committee. I am representing the Maryland Public Health Association, and we are a statewide membership organization of public health professionals working at all levels in health departments, universities, community organizations, policymakers, and more. And we are here in support of SB 263. As Laura said, Baltimore City did it. New York City also has done it a year later. They really made the healthy choice the preferred choice. Sugary drinks contribute nothing nutritionally to a child's growth and well-being, nor really adults for that matter. But here we're focusing on children, but they are contributing to the obesity epidemic. Almost 1 in 5 youth ages 10 to 17 are obese in Maryland, ranking us 19th of the 50 states in DC. And this is not a place that we want to be at all. Sugar sweetened beverages are one of the single largest calorie sources for Americans instead of being an occasional treat. So at MDPHA, we use a health and all policies approach for much of what we do. It's a collaborative approach that integrates health considerations into policymaking across sectors to improve the health of people in neighborhoods. And it recognizes that our greatest challenges, like childhood obesity, are highly complex and frequently linked to social determinants of health. These are the circumstances into which people are born, grow up, work, and play, and acknowledge that the greater social, economic, and political landscapes in which people exist affects our health. We have done many things as a society that passively make life better for all. I'm a huge classic car and sports nut, so I use car examples often. Over time, vehicles have become much, much safer, from headrests and crossbody belts all the way up to whole car crash awareness systems. Every time we get into a vehicle, as long as it's not a 1968 Corvette, we are more protected than we were even 5 or 10 years ago. This bill is like that. Every time our children are presented with a kid's meal, they are presented with the healthiest, safest beverage for them. It also helps them learn to make healthier choices from a young age, which they will carry into adulthood. We recommend a favorable report on Senate Bill 263. Thank you.
Thank you. Thanks very much. All right, we're going next to Natasha Mayhew.
Good afternoon.
Oh, sorry, I see Senator Reedy has his hand up. Let me see, what's your question for that one?
Madam Chair, I was going to wait for the panel to conclude. I didn't know where the panel was concluding, so I could wait till the panel is done. If that
okay, well, let's hear from Natasha Mayhew.
Good afternoon, Madam Chair, Vice Chair. members of the committee. Natasha May here on behalf of the Baltimore City Administration in support of Senate Bill 263. We are in support of it as it seeks to set a healthy baseline for children's meal beverages. In 2018, then Council Member Brandon Scott passed a bill that established healthy beverages for kids, this very bill in Baltimore City. And this was in light of the high levels of obesity, high intake of sugary sweetened beverages, and associated preventable illnesses that our city's children were facing. This law has been in effect for 4 years in the city. It has achieved shifting the focus to healthy beverages for children's meals. It has safeguarded the consumer's right to choose. And it has not put any undue burdens on the restaurants that offer these drinks. And so honestly, the bottom line is that it is an important and healthy step in the right direction. And so we support Senate Bill 263 and urge a favorable report. Thank you.
Thank you. All right, Senator Reid.
Thank you. Senator Bidle, is this, I was looking at the fiscal, is this all, when it says food service, I'm picturing food kiosk and food services inside entities, or is this all restaurants?
I believe it's all restaurants.
Okay. Can I ask maybe a question from anybody on the panel? I heard the term safeguard choice a second ago and making sure we ensure that parents have choice. Are they not given choice? Is the concern that they're not given choice now, or that they have to choose, they have to ask for the healthier option? Is that the concern?
So if I can answer that, Senator Reid, what we see right now is that when parents or when kids are looking at the kids menu, they're seeing the unhealthy choice first, or they'll say, you go to a restaurant, oh, do you want a soda? As opposed to having the healthy choice offered first. And what we see from the data and science tells us that if the healthy choice is offered, that's more likely to be the choice that is made. And also it doesn't create a situation where the kids hear, oh, let's have a soda, and they and the parents may want to give the other healthier option, but now they're in a tussle with their kid over, oh no, I heard soda, that's what I want right now, or I see soda on the menu. Parents still have the option to choose the soda, but what the research and the data has shown us from public health is that if we offer the healthy beverage first, if it's what they see on the menu as parents, that is the choice that tends to be made more often. And we see healthier outcomes from that decision.
Can I ask, I was looking through the list of, and I know you repeated it off, but is it basically anything that you're saying is a healthy choice is basically sugar-free or no sugar, or is it not sugar-free because that would be diet, but no sugar or sugar, or what, where do we draw the line?
So from what the research and what is recommended that we have are water, milk that does not have added sugar to that, or 100% fruit juice that meets certain standards about being made from fruit or from vegetables or a combination thereof. So it's not added sugars to that. Those are what are recommended from the American Academy of Pediatrics and from other health organizations about what we offer to our children.
Okay, thank you. And then a final question, and maybe Senator Bidle. I guess my concern here is, I mean, I hear about the science and the statistics, but a lot of people don't go out to eat every day. They go out maybe once a week or once or twice a week. So, and parents need to be able to have the ability, they need to be able to take ownership of what their kids are doing. I don't buy this argument that the government needs to be making everybody's, like, protecting everybody from themselves. So I guess, could you speak to the idea that why is this a proper role for government to be telling a private business that they have to offer a certain choice first? I mean, can you speak to that discomfort that I'm sure you understand that I have?
Thank you, Senator Reid. I think it's, as all the panelists have said, it's just the first choice. If a parent wants to order a soda for their child, they still can, but it's the choice that they see. I take my grandchildren out to dinner quite frequently. They're 3 and 5. And, when the choices, and they know the symbols, they know soda over, other things. So, we're always careful to order fruit juice. I don't know if it's 100% fruit juice. It could be full of sugar. I don't know that. It's just on the menu. So I think this is just a step in trying to raise healthy kids. As we heard earlier, it's a high percentage of kids that are dealing with obesity. And if we can help them learn to drink healthier beverages, it's a big issue. I don't know, Senator Rudy, if you've ever I know you have children, researched what corn syrup does to kids. And a lot of sugary fruit juices have corn syrup. You need to avoid that at all costs for your kids. So this is just a way to offer the healthy drinks first, but a parent can then order whatever they want.
I guess for me, my children are not given an option. We tell them what they're drinking when we go out somewhere. So that it's for me, it's just, that's me. But I have a concern about, and we don't typically give them anything with corn syrup, and generally speaking, but sometimes, but that they don't have sodas, but so that's kind of, I have a discomfort about us putting some sort of government regulation in on every business for what they get to put on their menu first. I think once we go that route, we're starting to get way too involved, but we're not here to debate the bill right now, but that's my concern, but I do appreciate the answers to the question. Thank you.
I appreciate your concern,
If I could
Senator.
follow up, Senator Bottle, the store is going to sell something, no matter which thing comes first. The child's going to have a beverage with their meal, and they're going to make a profit on what they're selling. Isn't that correct?
That's true.
So we aren't really hurting the owner. It's just a matter of parents being more aware as they work with their children, and the owner trying to cooperate with parents to make it less hard for parents to rear kids in a healthy manner, if that's the parent's desire. Is that kind of what we're doing?
Yes, ma'am. Thank you. Thank you, Madam Chair.
Thank you. Okay, we're going next to Reid Wise. He's a student. It's great to hear from a student.
Hello, Chair Kelly, and thank you so much again for this wonderful and unique opportunity to be able to be present and to present to you guys today, as well as to Vice Chair Feldman, the rest of the honorable members of the Finance Committee, and in particular, Senator Bidle for sponsoring this bill. My name is Reid Wise, and I'm currently a public health student, as you can see, at Johns Hopkins Bloomberg School of Public Health. But additionally, I am also finishing up my medical doctorate at Nova Southeastern University, and I hold a Master's of Science in Physiology and Biophysics from Georgetown. I speak to you today in strong support of Senate Bill 263. Children are the world's greatest resource, and as advocates and legislators, it's our duty to ensure that they are given the tools to be as successful as possible in today's immensely complicated world. It has been well documented in the literature, including publications from the American Association of Pediatrics, that excessive consumption of sugary beverages is linked to childhood obesity and other worsening health outcomes, such as tooth decay, heart disease, hypertension, diabetes, fatty liver disease, and all-cause mortality, among others. Importantly, school-age children are beginning to develop the habits that they will carry throughout their lives. While these habits will absolutely change somewhat throughout their lifetimes, fostering healthy habits early is a great way to ensure that our children and young people have the tools to take the charge of their fitness in a positive manner. The switch to water and other unsweetened beverages as the default for restaurant lunches will give all of our students the healthiest option from day one, while still maintaining the freedom of choice for children and their families to enjoy a soda or soft drink on occasion if they so desire. Thank you all again for the opportunity to speak to your committee. Once again, I speak from my own perspectives and represent my own views, but I urge a favorable report on SB 263.
Thank you. Our next speaker is Sara Rappaport.
Hi, I'm Sara Rappaport, a Senior Policy Associate at the Center for Science in the Public Interest. CSBI supports Senate Bill 263. The bill will support the health of Maryland children by ensuring healthier beverage options, but does not limit a parent or caregiver's ability to choose for their family. Leading health authorities in the US recommend limiting sugary drink intake, particularly for children, to reduce the risk for chronic disease. When children eat out, they typically consume more calories, added sugars and sugary drinks, and fewer fruits, vegetables, and whole grains than when they eat at home. Since restaurants are a significant source of daily calories for children, Improving the nutritional quality of beverages offered to children is critical in ensuring these beverages support, not harm, their health and nutrition. Designating particular foods and beverages as children's menu items or bundling them together as children's meals are powerful forms of marketing. This marketing helps to establish norms for children, affecting their preferences and lifelong eating patterns. 4 other states and approximately 24 localities have also turned to public policy to improve restaurant children's meals in their communities. In 2018, the city of Baltimore passed the first kids meal healthy default beverage bill on the East Coast. In 2020, Prince George's County became the first locality in the country to pass legislation that comprehensively addresses restaurant kids meals, which includes healthy default beverages. Montgomery County is currently considering a similar bill. These actions across the state indicate the interest local Maryland communities have in supporting and advocating for healthy options for their children and their families when they eat out. CSPI urges the Maryland General Assembly to join this growing movement and support children's health through Senate Bill 263. Thank you.
Thank you. All right, our next witness is Sara Rappaport. Oh, I'm sorry, Ellen Valentino.
Thank you and good afternoon, Madam Chairwoman. My name is Ellen Valentino. I'm here today representing Maryland's local beverage companies. We recognize that parents are more than capable of making the food and beverage choices that are best for their families. When it comes to their youngest children, we have repeatedly heard from parents and others that water, milk, and juices are the best options. However, they also need to be able to select and make their own beverages. The language in this legislation around the default beverages should be amended. I've offered some committee some amendments that I've put forward. This is not the language that exists in Baltimore City, Wilmington, Delaware, or New York City. It is not the standard language that the advocates have advocated for in other jurisdictions, minus Prince George's County. Their default beverages do not allow for sparkling water or flavored water with no natural or artificial flavors, nor as drafted would allow for 100% juice or vegetable juice with added water. So we do support the legislation. We would put some amendments forward and would like to see there be some continuity with the Baltimore City language, which we worked on and supported with the advocates and other jurisdictions around the country. Thank you.
Thank you. All right. Next is Dominic Butchko.
Thank you, Madam Chair. My name is Dominic Butchko. I'm an associate director at the Maryland Association of Counties. My testimony here is going to be really brief. I think everyone has heard that there are numerous counties across the state trying to enact similar legislation. MACO's only concern here is that this bill sets a universal standard instead of a floor so that counties can go above and beyond, especially when the science changes or there's different community needs. MACO would only like to see an amendment to have this bill set a floor instead of a universal standard. And because of that, we urge a favorable report from the committee with amendments. Thank you.
Okay. Would you suggest some language back and send it to us so our analysts could take a look?
Yes, definitely.
In that regard. Thank you. Okay. And then Melvin Thompson from the Restaurant Association of Maryland.
Thank you, Madam Chair, members of the committee. I'm Melvin Thompson, representing the Restaurant Association of Maryland. And we are testifying in opposition to Senate Bill 263 today, but only as it is currently drafted. However, we have reached out to Senator Bidle's office to discuss amendments that we will be seeking to make the requirements under this legislation more workable for the food service industry, especially for our smaller independent restaurant operators. We will be requesting amendments to allow for flavored milk to also be offered as a default beverage because it is popular with children. And also a recent USDA Dietary Guidelines Advisory Committee found that 79% of children ages 9 through 13 that participate in the National School Lunch Program are not meeting the recommended intake of dairy foods. And so current USDA flexibilities allow schools to offer low-fat flavored milk to improve milk consumption for this age group. And we will also be requesting amendments to change the serving size limit for juice from 6 to 8 ounces, and to also allow 100% fruit or vegetable juice combined with water in a serving size up to 8 ounces. Limiting the serving sizes of juice and juice water combinations to 6 ounces creates an unnecessary burden, because it would prohibit restaurants from using commonly available and affordable serving sizes. We do not know of any other state or local law that limits such beverages to 6 ounces. In fact, similar laws in Baltimore City and Prince George's County also allow for 8-ounce serving sizes for such beverages, and we believe that the state legislation should be consistent with that. We thank you very much for your time, and we will be working with Senator Bidle on these amendments. Thank you.
I would just like to butt in, I'm not Senator Bidle, to say that I think we've heard several really good suggestions, because we do need standardization as far as we can while we're working on the goals, which I think are laudable. And for the restaurants to come in today to tell us, well, you want each thing a little bit differently than anything else we've heard from even those counties that have begun the process, would make it harder for us to all get on one page, which in the longer run probably will hurt restaurants too. I'm surprised you didn't mention it, Melvin, but I would imagine if I were a restaurateur and across the street you're in a different county and everybody had a different standard, I would find it harder to know what I'm doing.
You're correct, Madam Chair. We're looking for consistency here.
Standardization, and this is going to be a statewide bill. And so we want to look to see how workable some of the moves are that people have already undertaken as initiatives in this regard. If Madam Chair doesn't mind my saying that, Madam Sponsor.
Thank you, Thank you, Madam Chair.
All right, that's the end of the testimony on this really good bill that's going to be even better when we vote on it. Thank you. Okay, we're going next to Senate Bill 3, Senator Carter. Facilities, disabilities, juvenile behavioral health, and health care safety plans. You're on, Senator.
Thanks, Madam Chair. Thank you, committee, for listening to the bill. This bill is a cross-file of one of my delegates, Delegate Rosenberg, and it was brought based on an effort to give our constituents in our community a little bit more comfort. So what it does is it expands a bill that passed unanimously last year, sponsored by Senator McCray, which basically required all behavioral health programs to establish and implement a safety plan for the well-being of all individuals involved, community and members of the behavioral health programs. This bill expands that provision to residential centers and group homes that serve juveniles and persons with disabilities. It also ensures that those plans will be kept up to date, relevant, and regularly improved to keep up with best practices. The bill seeks to improve the relationship between the neighborhoods and the facility residents. We know that the most effective path to rehabilitation is reintegration. The bill will help erase the stigma associated with child offenders and work to reestablish camaraderie in our communities to benefit all of our constituents. By requiring organizations serving vulnerable individuals to reevaluate their safety protocols at least every 5 years, this bill holds appropriate organizations to similar standards set by the federal government. Senate Bill 3 will therefore protect the safety of vulnerable individuals without imposing excessive or unreasonable administrative demands on the centers providing the services. And so with that, in your files, you should see a letter signed by, I believe, 5 of our 41st District Neighborhood Association presidents that are in full support of the bill. They feel that it would be a step that we could take to give them some comfort about these facilities coming up in their neighborhoods. And so it's really a constituent-driven piece of legislation. Thank you.
Thank you. Okay, we're going next to Lauren Callens, Maryland Association of Community Services.
Thank you, Madam Chair, Mr. Vice Chairman, and distinguished members of the committee. I'm Lauren Callens with the Maryland Association of Community Services, and we represent providers of community services to people with intellectual and developmental disabilities. And we appreciate and share the sponsor's concern about safety. In fact, safety is absolutely at the core of all of the supports and services that our members provide in order to help people with IDD live inclusive lives in the community. And for this reason, it's not a surprise that COMAR already very heavily regulates IDD providers in this regard. Every provider, for every person they support as part of the regular licensing process, must provide a very detailed plan that includes a description of how that person's safety and health needs are being met. And in addition, for our group home providers who are captured by this bill in particular, they are required to also provide very detailed plans that describe evacuation plans and other arrangements for a variety of disasters. So what would happen in the event of an evacuation, preservation of records, communication with family members, training of staff and how to respond, and more. And this is part of the regular licensing process. And so we are here today in support with an amendment. And the amendment asks, and this tracks language that was added to Senator McCrae's bill last year that we supported, and would provide that a safety or emergency plan created for another purpose may satisfy the requirements of this section, of the subtitle. And we have shared that request and that language with both the House and Senate sponsor, and it's our understanding that the House sponsor plans to add it as a sponsor amendment, and we hope you will take a moment to review and support the language. Thank you.
Thank you. Are there any questions? All right, if not, then that ends the testimony on this good bill. Okay, we're going next to Senator Hershey, Senate Bill 242, Maryland Department of Health Systems for Newborn Screening Requirements. Senator, you're on.
Thank you very much, Madam Chair, members of the committee. For the record, Senator Steve Hershey to present Senate Bill 242, which will help improve the process by which Maryland screens newborn babies for treatable rare disorders, saving countless babies' lives, as well as saving money to our healthcare system in the process. Senate Bill 242 will require that newborn screening in Maryland includes screening for each of the conditions listed in the U.S. Department of Health and Human Services Recommended Uniform Screening Panel, or RUSP, within 2 years of the condition being added to that panel. With this, we will ensure that all newborns in Maryland receive the most updated, comprehensive medical attention that they deserve from the very beginning of their lives. Currently in Maryland, when babies are born, unless the parents choose to opt out, they receive the benefit of a newborn screening panel test as part of the state's newborn screening process. The newborn screen is a special test that is used to test babies for 50 serious medical conditions in order to identify babies who have specific disorders before they get sick, helping them get treatment as soon as possible. It is important to note that the disorders on RUSP are chosen based on evidence that supports the potential net benefit of screening, the ability of states to screen for the disorder, the ability of effective treatments that are usable before babies get sick or show symptoms. Through early detection and treatment, many of these conditions can be treated and prevent future healthcare expenses, as well as necessary trauma to babies and their families. Madam Chair, the committee should also have a sponsor amendment that will clarify this bill that will only apply to conditions in the RUSP core conditions listed on RUSP, rather than both core and secondary conditions. This aligns Maryland with the 6 other states that have recently passed similar legislations. Madam Chair, I have a very knowledgeable panel of experts that can speak to some of the specifics on RUSP and the listed disorders. There are also numerous letters of support in committee testimony. With that, Madam Chair and colleagues, I ask for your favorable report on Senate Bill 242. Thank you.
Thank you. So we'll go right to your witnesses. Each witness will have 2 minutes, and we'll start with Claudia Fennell.
Thank you, Madam Chair, members of the committee. My name is Claudia Fennell. I'm a parent to an 8-year-old girl with a rare neurodegenerative genetic disorder called Batten disease, type CLN2. Our family is located in Bethesda, and I'm here to express my urgent support for Senate Bill 242, which, as you've heard, ensures that Maryland's newborn screening program continues to align, as it has very well so far, with the federal RUS recommendations in a timely way. Maryland families will then experience the life-saving benefits of early diagnosis, and our story kind of illustrates that. I support this bill because diagnosis at birth has the ability to completely transform the lives of Batten disease families like ours and other rare pediatric disorders that often take years to identify. Penelope, our daughter, was a healthy child, completely asymptomatic until she was 3. And then suddenly she developed intractable seizures, lost her ability to walk, and most of her ability to speak and eat. It was extremely difficult to find a diagnosis, delaying treatment when every week counted. Only after we had a diagnosis were we able to start a therapy which dramatically slows the progression of this serious disorder. We now know that earlier treatment could have significantly changed the course of her disease. The effects of Penelope's delayed diagnosis permeate every aspect of our lives. The complexity and irregularity of her health status means that I'm unable to return to the workforce, for example. Consider, if you will, the aggregate impact of delayed diagnosis on Maryland families affected by pediatric illness. It is certainly significant. I urge you to support Senate Bill 242, again, in order to allow families timely access to critical advances in treatment and as a safety net of early diagnosis that meets national standards and to reduce the financial impact of illness on families. Thank you for your time today.
Thank you so very much. It's helpful for us to hear from the perspective of people going through a problem. Okay, that was very helpful. All right, we're going next to Claudia Fennell.
You just called her.
Oh, I'm sorry, to Catherine Salam, the Maryland affiliate of the American College of Nurse Midwives.
Okay, greetings. Yes, I'm Catherine Salam. I'm a certified nurse midwife. I'm the vice president of the Maryland affiliate of the American College of Nurse Midwives and a longtime member of our legislative committee. I speak in support of Senate Bill 242 to advocate that requiring that disorders recommended by the U.S. Department of Health and Human Services are added to the state screening panel within 2 years. I'm a retired clinician, having practiced in Baltimore City for many years at Maryland General Hospital, and then at Chase Brexton Health Services with privileges at Sinai Hospital of Baltimore. In prenatal exam and postpartum hospital rooms, I have had many opportunities to counsel patients and families about newborn screening tests and the benefits of early detection of genetic conditions for which treatment can prevent long-term adverse medical consequences for the infant. Even though some of these are rare diseases, if your infant is affected, the incidence is 100%, as we have just heard from Claudia. You may be familiar with nurse midwifery practice, but believe that once we catch the baby, we're no longer involved with its care. However, our core competencies include care of the newborn for up to 28 days of life, including, quote, testing and screening according to local and national guidelines, and health education specific to the needs of the neonate and family. So again, I urge your positive consideration of this bill. Thank you very much for your attention.
And thank you for your testimony. All right, we're going next to Scott Tiffin, ACNM Every Life. We didn't have a lot of room, so we've got an acronym. You can tell us what your organization's name is fully.
Perfect. Thank you, Madam Chair and members of the committee. My name is Scott Tiffin. I'm here to support the American Academy of Midwives, as well as Every Life Foundation, who you'll hear from, I think, after me. I mostly wanted to be on just in case there's any questions I could help answer. But I did want to note that the state has never decided not to add a core condition to the state panel. But what we are seeing is that over time, the amount of time it takes before they will take a federal recommendation and add it to the state panel is increasing. So the one disorder that's currently sitting out there, it's been about 6 years since it was recommended federally. So this bill will just give a predictable timeline to families to make sure that, you know, we can ramp up the testing, of course, over those 2 years, but once it's ready to go, everyone can get access to the best possible testing and treatment. Thank you for your consideration.
It's certainly important. If you've got a test and time is of the essence, you need to have it forthwith. All right, thank you. All right, we're going next to Jennifer Payne.
Madam Chair, thank you for the opportunity to share my testimony with you today in support of Senate Bill 242 as an ambassador for the greater Maryland rare disease community. It is with deep and heartfelt gratitude for the state of Maryland's newborn screening program that I come to you today as an adult beneficiary and among the first diagnosed in the state with the rare genetic disorder phenylketonuria, or PKU, in 1973. Thanks to newborn screening, timely diagnosis, and early treatment spared me a lifetime of institutional care. Because of my age, only I can offer you living testimony to the power of prevention. With my historical perspectives on growing up in Maryland's PKU program in the early days, and speak directly to the legislative impact of this powerful public health policy tool that saved my life and my children's lives. I ask you to reaffirm this commitment with passage of Senate Bill 242, because preventing devastating illnesses and diseases before they become too serious and too costly to treat benefits all Americans to live well. Early detection and early treatment are critical for the clinical management of PKU, the effects for which the brain and the central nervous system are the target organs of damage stem from a deficiency or inability of the liver to metabolize phenylalanine or Phe, a building block of protein found in virtually every food. Given my medical history and risk with PKU, and knowing the accumulation of Phe is also teratogenic to offspring of untreated mothers, I can proudly say my children are all healthy and alive thanks to newborn screening. As I've demonstrated, Maryland's participation in RUSP alignment is critical to saving lives, and having the necessary resources available to fund the conditions added to RUSP is as equally critical. For not only was our family impacted with dire and direct consequences of this action, but screening and ensuring a continuation in these effective health programs will only result in a net gain to taxpayers and cost savings to the government. Again, I offer you living proof. The mission we share is one and the same. It comes down to saving lives. Thank you for the opportunity to speak in support of Senate Bill 242.
Thank you. All right, we're going next to Dillon Simon.
Thank you, Madam Chair, and for the committee for providing me the opportunity to speak today. My name is Dillon Simon. I'm the Associate Director of Public Policy at the Every Life Foundation for Rare Diseases. Similar to Scott, I'm here mostly just to support the advocates as best I can. We are strong supporters of this bill and advocate for in the 6 states that Senator Hershey referenced where it's passed already. I also want to note that within the written testimony that I submitted today is a sign letter of 60 patient advocacy organizations who all support this legislation, who recognize the impact of newborn screening and the importance of early diagnosis, allowing for early treatment. And with that, I will yield my time back and happy to answer any questions.
Thank you. I've got one before I go to our last witness. And any one of you who has testified could just answer it, but just once. I'm really interested in knowing if the state of Maryland has handily, both with nurse midwives and with hospitals that have birthing centers and so on, a list of some of the more common situations that kids are being born with that are going to be these kinds of grave and long living disabling situations, so that they've got something to look for or an idea of what maybe they ought to be watching for early in the child's life in the event nothing showed up at birth.
That's a really good question, Madam Chair. These are definitely disorders that folks who work in obstetrics or in pediatrics really are getting trained on and are going to have competency on while they're in schooling and going through their exams and things like that. So there definitely are, different ways for developmental markers and things like that that our clinicians definitely are able to kind of help families identify these disorders if we miss them in the screening. But sometimes if we're not screening early, it might be too late to really connect them to the best possible treatment.
Okay. Well, if I can add in, thank you, Scott. When we, after a birth, when we fill out the birth certificate, part of the birth certificate identifies any immediately detectable birth defects, which are primarily physical, in this instance. But the screening program identifies conditions that are more of a longer-term diagnosis, so to speak. Often in all cases, the newborn has already been discharged from the hospital. Some of these screening tests have to be done after the first 24 hours of life. For example, the PKU that Jennifer talked about, the baby needs to have had 24 hours of milk feeding in order for the test to identify whether they can metabolize the proteins. And then again, it's repeated around 10 days of life for increased accuracy. So the point being that this is a matter of long-term follow-up. Pediatricians probably could address this better. And there are registries, I'm sure within HHS, there are registries for, incidence and prevalence of these neurological disorders.
That's helpful. I was just thinking, if there were some of these diseases that you see no symptoms, maybe for a few weeks or a couple of months or something, so you're home, but you don't know that there's a pattern that has a name to it and that it's a recognizable set of circumstances that would require some screening. So if there is some kind of a bibliography that the state should have available somewhere, or a list of things that new parents could look for, you could get back to us, but you've been really helpful. We've got to go now to Susan Sullivan.
Hello, Madam Chair. My name is Susan Sullivan, and I'm a constituent of District 3B. I thank you for the opportunity today to share my testimony in support of SB 242. I am a mother whose son, Daniel, passed away in 2018 from metachromatic leukodystrophy, or MLD, a neurological disease that was curable if detected at birth. I cannot express the pain of knowing that if we had done the right test at the right time, Daniel would be with us today. As science advances, more diseases are becoming like my son's, treatable at birth before irreversible damage is done. Newborn screening for diseases like this are our most effective way to ensure that all babies have an equal chance at life. I ask you to affirm this commitment today with the passage of SB 242 because Maryland's newborn screening efforts lag behind its potential. Maryland should begin screening for diseases like MLD as soon as they are added to the RUSP. Maryland's newborn screening efforts trail other states. Adrenoleukodystrophy, or ALD, was added to the RUSP in 2016. And while 25 states and DC all test for the disorder, Maryland does not 6 years later. Early detection is critical for many diseases, particularly neurological diseases like my son's. Treatment can only halt the damage to the brain and nervous system. If the disease is diagnosed through the symptoms, it is too late for treatment. Since ALD was added to the RUSP in 2016, an estimated 12 babies have been born in Maryland with a severe version of ALD and have gone undiagnosed. If Maryland had begun screening in 2 years, as this bill proposes, 8 of those children would have been saved. Thank you for the opportunity to speak in support of SB 242. Maryland is ranked 5th in the nation in healthcare, yet we are trailing in newborn screening. I want us to have a state where other families do not have to experience the pain that I did. Maryland has been a leader in rare disease research, and I ask you that we become a leader in newborn screening once again. Your statehood should not determine your baby's opportunity for a healthy life.
We all certainly agree. Thank you so very much. Okay, we're going now to Senate Bill 34, Senator Young, residential elevators inspections.
Thank you, Madam Chair, Vice Chair, and members of the Finance Committee. Senate Bill 34 seeks to add residential elevator inspections to Maryland law. Our current law only requires inspections of commercial and public building elevators. On average, each year in the United States, around 2,000 children under the age of 19 are injured or killed in elevator-related accidents. Residential elevator injuries are caused by the door closing on a body part, the child getting caught and crushed between the door and the elevator carriage. An issue that's easily remedied by reducing the space between the doors to a standard of 4 inches. A standard that we thankfully adopted into our laws by including the American Society of Mechanical Engineers safety standards of 4-inch gaps for elevators. Unfortunately, it only applies to elevators that are inspected. Furthermore, ASME codes only apply to elevators installed after 2017, leaving hundreds of thousands of currently installed residential elevators in the United States uninspected. We don't know how many of these elevators are in Maryland because the Maryland Department of Labor doesn't provide information on private residential elevators, just commercial elevators. In July 2021, the Federal Consumer Product and Safety Commission issued its first ever safety recall for residential elevators due to the danger posed to children. But the recall involves only about 5,000 home elevators out of the estimated 300 to 500,000 installed residential elevators. Furthermore, only one manufacturer, Otis Elevator Company, voluntarily agreed to the recall. And I'm not sure, but I believe they have gotten out of the residential elevator business. So Senate Bill 34 seeks to correct this safety issue by requiring inspections upon installation of a new elevator and each time the home changes ownership. The inspections would be conducted by a third-party elevator inspector licensed by the state. In addition, the cost of inspection, repairs, and upgrades are paid by the homeowner if the repair is not already covered by a recall. I point this out because the last time this bill was in, it had an unfavorable, very high fiscal note, but that was with our department taking on the inspections, which they didn't really want to do. So what we are calling for now is that someone would install the elevator and another company would verify that it met the standards. So I ask that you vote favorably on Senate Bill 34 to correct this public safety issue, particularly for children. And I would offer one amendment. Senator Benson asked to be put on as a co-sponsor. So at this point, if there are questions, I have a panel ready.
Thank you. Do we have the form for Senator Benson's addition to the sponsor list?
I believe so, but if not, I'll make sure it gets there.
Thank you. All right, we have Kevin Sullivan next. And Mr. Sullivan, if you would tell, I see you're here all the way from Norfolk, Massachusetts. What is EIWPF? So we know what that acronym stands for.
Yes, ma'am. It is the Elevator Industry Work Preservation Fund.
Thank you.
You're welcome.
All right, now each witness has 2 minutes, and then we'll move on to the next person. Thank you.
And I'm first?
Yes.
So, okay. Good afternoon, Madam Chair Kelly, Vice Chair Feldman, and members of the Senate Finance Committee. I am Kevin Sullivan. I'm a national coordinator with the Elevator Industry Work Preservation Fund. For the past 23 years, I've worked on elevator safety issues and elevator safety legislation across the United States. I am a graduate of the National Elevator Industry Educational Program, achieving the status of mechanic. I am also a graduate of the Qualified Elevator Inspector Training Program, achieving the designation of Qualified Elevator Inspector. I want to say thank you for the opportunity to testify in favor of Senate Bill 34, residential elevators and inspections. First off, I'd like to apologize to the committee members. If it wasn't for COVID and social distancing restrictions, we would have come to all of your offices to talk about this bill and this important safety issue, but we weren't able to do that this year, unfortunately. So sort of the background on why we're here. This summer, there was a 7-year-old boy was in Corolla, North Carolina, was crushed to death by a home elevator. His parents, his sister, his grandparents were all in the house at the time, and they witnessed this terrible tragedy. In August, myself and a couple of colleagues had traveled to North Carolina to learn more about the accident and to find out solutions to prevent it from happening in the future. While we were in North Carolina, a similar accident occurred in Potomac, Maryland. Fortunately, this young boy survived the accident. The state of Maryland does not regulate private residence elevators. So we started working on a bill that called for final acceptance inspections on all newly installed home elevators. Fortunately for us, as we were working on this legislation, we received an alert on Senator Young's bill, and it was similar and almost identical to what we were looking to do. And so we contacted the senator and asked to join his team. And we've been working together for about the past month on this issue. All elevators in the state of Maryland undergo a final acceptance inspection, except private residence elevators. Final acceptance is the most important inspection done on an elevator. It is a final check of the electrical, mechanical, and most importantly, it's a check on the safety features of the elevator. An elevator cannot be put into service or cannot be ridden by passengers until passing this inspection. And let me repeat, all elevators in the state of Maryland undergo the final acceptance inspection, except private residence elevators. The problem is fixable. There is a gap that exists between the door of the elevator and the door to the hallway of the home. That door gap is similar to what you would see in a hotel that had 2 connected sleeping rooms. There's a door on each side and then a small gap in between. And that is where the problem occurs. Someone can get into that space. When both doors close, the elevator will run. And in the case in Maryland, it was a 7-year-old boy was in that space and he was crushed. We have a great group today to testify, over 160 years of experience. We have an owner of a company that does these installations. His name is Ken Goff. We have an inspector, Tim Marshall, who has inspected private residence elevators. We also have another coordinator with the Work Preservation Fund, Don Winkle, who is an instructor of elevator inspectors. He's also a member of the ASME Elevator Safety Code for private residence elevators. I just want to say thank you for the time. I ask for your favorable support of Senate Bill 34, and I would be happy to answer any questions now or at the conclusion of all the testimony.
Okay, thank you. We'll go then to Ken Go, Preferred Elevator Company.
Yes, hello there, Madam Chair. My name's Ken Golf. I'm with Preferred Elevator Company. I started in the elevator industry in 1986. I became a licensed or a certified elevator mechanic through the National Elevator Industry in 1989. I worked for the major companies, ThyssenKrupp Elevator, from 1986 until 2005. And as a mechanic, a foreman, a superintendent, working primarily on construction or commercial units. In 2005, I started Preferred Elevator Company, where we focus on the installation, the service, and maintenance of residential elevators and what we call a vertical platform lift. Today's talking about residential elevators. So it's 17 years in the residential market. I've seen coming out of the commercial side, many hazardous conditions that exist in these older home elevators. And they've never been checked. Nobody's been there. Sometimes we'll go in a home, they'll service the elevator. They'll tell me that this elevator's been running for 20, 25 years. No mechanic, no elevator company's ever been there. We go there and things are disastrous as far as safety goes. So this is a big reason why I'm so in favor for Senate Bill 34, because the new installs need to be done properly and they need to be inspected and tested. Inspections are no good unless we do a test on these home elevators, which will consist of the elevator mechanic and a crew coming into the home with test weights, putting a full load, capacity load on it, testing the safeties. If it's a hydraulic unit, pressures need to be taken, and things need to be set up properly for the safety of the end user, which is children, adults, disabled people. I could go on for hours.
I know you could, and all we had was 2 minutes per witness.
So
but you're helping us to realize the significance of it, and I need to move on to another witness, so we're going to be here till midnight, and some witnesses won't get heard. Thank you.
Right,
Frank Boston is next.
Good afternoon, Madam Chair, members of the committee. I am Frank Boston III, and I'm the legislative lawyer for the Elevator Industry Work Preservation Fund. I want to thank Senator Young for sponsoring the bill. You know, my client consists of elevator mechanics unions as well as the actual companies. So it's the coalition of both. And collectively, we were going to put in this legislation until we saw that Senator Young had basically the exact same thing that we were looking to achieve. So we are rallying behind this bill. As you know, elevator safety and our elevator agenda is not new to this committee. We worked hard, and we flushed out many issues as it pertains to safety. And this one is a no-brainer. It seems like it would make common sense that, you know, any new elevator installed in a residential home or even at the change of ownership should have some sort of inspection. I will leave the expert testimony for those who actually do the work, but I will like to point out to the committee the fiscal effect to the state is the cost of $38,000 a year. That's it. And even after 5 years, it only raises up to $67,000. And the reason for that cost is the department said that it's going to be more administrative work, and they're going to need to hire another position and pay someone, I think, $29,611 and operating expenses of $8,453. So that's $38,000. So it's a minimum fiscal note, much needed to add a position, and I'll defer to the other experts who will answer your tedious questions.
Thank you so very much.
Yep.
We're going next to Donald Winkle. Mr. Winkle available? Okay, if he's not here, then.
I'm sorry, Chairwoman, I was muted.
Okay, Mr. Winkle, you're on. You got
Good afternoon, and thank you to the chair and to the committee for allowing me this time. My name is Don Winkle. I'm a licensed elevator mechanic, quality elevator inspector, and a member of the American Society of Mechanical Engineers Private Residence Elevator Committee. That committee worked tirelessly on code changes in 2016 and 2019, which were created and passed by ASME to reduce the distances between private residence elevator doors so that small children's lives would be saved. In-depth data was used and the space between the doors was reduced so that most, if not all children will be able to, they cannot be able to be standing in that area where they could be crushed. But the codes are only codes and they're not worth the paper they're written on unless they're enforced, whether it's in a commercial setting or a residential setting. I mean, the state of Maryland presently inspects the plumbing and heating and electrical on new residential homes. And you also protect children in residential dwellings, particularly rentals, from the hazards of lead poisoning, which you know is cumulative over time. But the state doesn't protect our children from the possible dangers that can exist from an improperly installed, uninspected private residence elevator. While lead exposure will cause lifetime health issues for a child, exposure to an improperly installed conveyance will often lead to catastrophic injuries and most of the time death. A residential elevator is potentially one of the most dangerous items in a family home if not installed and inspected properly, which at a minimum should be done after your initial installation or when a home is sold or transferred. This would ensure that the unit is within the safety parameters required in the code. The current problem that we have is that the safety parameters are not enforced. The code is not, it isn't that the code isn't protecting the children. The code exists, but that the conveyances that are being installed are non-compliant to the code, and there's no law protecting Maryland's children from these non-compliant residential conveyances. Most code enforcement legislation is written in blood and normally is reactive. I urge you a favorable report on Senate Bill 34 to protect Maryland's children and to avoid another private residence elevator fatality. Because without legislation, the question is not whether another fatality will happen, it's when it will happen. Thank you, Chair.
Thank you. Thank you. Senator Kramer has his hand up. Senator, you have a question?
Yeah, thanks, ma'am. I think Senator Young, oh no, he's still with us. That's good. And I don't know whether this is a good question for the senator. I get it. I understand the purpose and the intent. I don't think anybody questions that. The initial installation inspection, easily done. What I'm not sure about, and I already get complaints from constituents because I sit on this committee, and actually not necessarily constituents, people around the state trying to get their commercial elevators inspected in a timely fashion and coordinate the process, because we've changed it in the finance committee that the inspecting entity has to meet with now the inspector on the site. There's something that we've done with the commercial inspections, but the bottom line is I'm not sure with this issue of the resale of the home, exactly how that may play out and what unintended consequences there may be with settling in a timely fashion with regard to the inspection. If the inspection is done as part of, prior to the settlement, it turns out there's an issue, or you could have a homeowner who has abandoned the elevator. Are they expected now to put the money into repairing this elevator before they're permitted to go to settlement? So has there been some contemplation as to how this subsequent to the initial inspection happens when the house is being sold?
We're probably going to have regulations developed, and we ought to have somebody like you at the meetings to make sure all those questions are asked. David Smolsky is our analyst on it, and I'm going to suggest that maybe we talk to David regarding that. Senator Young, do you have an idea?
First off, I mean, I just purchased a new home in August, and we have a whole series of inspections you have to do as part of the settlement. So this would just be one more of those.
But my understanding, with all due respect, Senator, I don't think any of those inspections are under law required to be paid for by the homeowner. That is stipulated in this bill. I know that if I'm buying a house and the inspector says, hey, I see some mold in your crawl space. Depending on what I signed in the purchase contract, it may simply be, owner says, hey, purchaser, I'm selling the house as is. If you want it, you're fixing it. This states that the homeowner is responsible. So there is a difference there.
I have no problem if you switch it back to the seller. We just wanted to inspect it when the home changes so that we know that the elevator is safe. You also brought up the issue about if it's abandoned, then I would think they would just, if they're not going to use it, they would have to close it up and see that it was secure.
Well, in any case, we probably aren't going to solve it right now in this setting now. But I'd suggest that the sponsor and you, Senator Kramer, and maybe our analysts could sit down and figure out what we need to do and if we need any.
All righty then. Thank you, Madam.
That's good by me.
If I may, Madam Chair, we discussed this, Senator Kramer, and we're fine moving it to the buyer.
I didn't quite hear you, Frank, but you and I can talk offline.
I said we're fine moving it to the buyer and making a buyer responsibility, just like other inspections, as you mentioned. We've had that discussion internally.
You mean the seller?
We'll talk offline.
Yeah, we'll talk.
Okay. All right. All right. And our final witness is Timothy Marshall, who's favorable with some amendments.
Good afternoon, Madam Chair, Mr. Vice Chairman, and members of the Finance Committee. Thank you for the opportunity to speak to you about Senate Bill 34, residential elevator inspections.
Get in there.
Kids are being killed by residential elevators, and our state has done nothing to prevent it. The big issue is the elevator installer does not normally supply the hoistway doors. Because they typically match the other doors in the house, these are provided by the contractor. These doors are not designed to meet current elevator code. If you look behind me, this is basically the guide you use to actually indicate if it passes or not. The old code before 2016 was 5 inches. Now we've reduced it down to 4 inches. And then, so basically I recently was selected to be an expert witness for a case in North Carolina. I saw firsthand how easily this loss of life could have been prevented. Just like Maryland, North Carolina does not have any type of residential elevator inspections. The maximum clearance allowed between the accordion gate, which is shown behind me, and the hoistway door is 5 inches. That's the code prior to 2016. This elevator in North Carolina was installed in 2003 and was sold to the current owner in 2013. It was installed with a clearance that measured more than 8 inches. This child was 7 years old. The elevator moved in the up direction with the young boy hiding in the elevator threshold. His father acted heroically and tried to free his child, but to no avail. The lifeless body of the child was dropped into his arms as the firefighters were able to lower the elevator. During our investigation, I vacuumed pieces of bloody glass from the elevator sill so we could check the operation, verify the interlocks, the gate switches were all working properly. Everything was operational, but the illegal gap killed this child. This accident was preventable. I am in favor of Senate Bill 34 with the following amendments. Remove the exemption for units installed prior to January 1, 2023, and have any dangerous gap made safer by placing space guards on the hoistway doors or installing electric monitoring devices that would detect the elevator or deactivate the elevator when the child is detected in the gap. Qualified elevator inspectors can examine residential elevators for this dangerous gap and other potential safety hazards. And we will also provide a list of all the residential units that we inspect so that the DLR could then start a database. Senate Bill 34 would prevent these senseless accidents, primarily affecting children, by bringing residential elevators up to code with Maryland law that already applies to our commercial elevators in the state. I respectfully request a favorable report on the Senate Bill 34. And just like we talked earlier, we provide protection for kids from lead paint, for pool safety, and we need to protect kids from unsafe elevators, especially at home rental locations. The job that I talked about in North Carolina was a home rental. So these people, it's the first time they'd ever played with an elevator. And unfortunately, they use it as something to play with. The discussion after my testimony regarding similar bill, House 257, centered around the cost impact of the homeowners. Most people that own houses with an elevator can afford to test them for code compliance. Unfortunately, the costs are being borne by children and families that use the elevators without any idea of the possible dangers. How much would you be willing to pay to get your child's life back? Thank you for your time and questions.
Thank you. If you would be willing to be contacted to give us just a rough idea of the language that you're talking about for removal of this exemption, then our analysts, and I'm going to ask Senator Kramer from our committee. Senator, you seem knowledgeable and interested. Would you be willing to work with David on this? Okay, well, David's confident. David will work with us on it. We will try to get this resolved. And that was our last witness on that bill. Very important issue. Thank you. We're going next to Senator Jackson. Innkeepers, maintenance of guest records, and employee human trafficking awareness, training, and policy. Senator, you have the time you need to explain your bill, and then each witness will have 2 minutes.
Thank you very much, Madam Chair, members of the Senate Finance Committee. For the record, I'm Senator Michael Jackson on behalf of Senate Bill 91. Senate Bill 91 is a piece of legislation that I brought before you last session. This is drafted to help stop the spread of crime of human trafficking in our communities and to bring about an end to the suffering endured by its victims. This bill would do 2 simple things. It will require the Governor's Office of Crime Control and Prevention, Youth and Victim Services and the Maryland Department of Labor to develop an education program offering guidance to employees of hotels on ways to recognize the signs associated with human trafficking. Costs and effort associated with the development of such a program will be minimal, as both the Governor's Office and the Maryland Department of Labor have indicated that a great deal of related materials have already been produced by the United States Department of Homeland Security. After the development of the program beginning in 2022, innkeepers would then need to annually certify to the department the completion of said program by their employees. The bill also requires innkeepers to maintain a computerized record-keeping system of all guest receipts for a minimum of 6 months. This feature of the bill would provide law enforcement officials a critical tool in tracking down the perpetrators of these crimes. As you all may well know, my professional background leads me to have a keen interest in law enforcement issues, and this issue is one of my top priorities. As Prince George's County Sheriff, we unfortunately dealt with this, having our agency abutted to the largest county in the state of Maryland, located in the southern part of the state, as well as abutted next to Washington, D.C. and Virginia. Ensuring the law enforcement officers have the useful tools at their disposal to stop the suffering endured by those victimized by human trafficking is a priority I believe this bill can help us achieve. I'm confident this legislation and its aim will lead us in that direction, Madam Chair. Each member of your committee, Madam Chair, should have an amendment that came across today that we are in support of with the innkeepers. If you'd like, I could read the amendment number. But what that amendment would do is would further clarify our position on the bill. I believe
we do have it in our file, and we'll make sure everybody has seen it, that it's been discussed before there's voting. Yeah.
Okay, thank you very much. And Madam Chair, as I stated at the beginning, I brought this bill before you last year. We know how vital it is as Maryland continues to grow itself economically. The more facilities that we erect to invite business to the state of Maryland, we need to make sure that the citizens of our state are remaining safe. So with that, Madam Chair, members of the committee, I ask the committee for a favorable report, and I stand to be a part of the panel that will address questions because we have other experts behind me. Thank you very much.
Thank you. Do you have any questions of the sponsor? All right, at this time, then we're going next to Amy Blank, the Baltimore County Commission for Women.
Thank you, Madam Chair, members of the committee. Human trafficking is the largest illegal enterprise in the world. 27 million people are trafficked every year at about $150 billion. About 17,000 of them come into the United States. However, 200,000 are from the United States. They're predominantly girls and women starting at the age of 12 years old. And they come in communities, from communities with high volumes of poverty. The intersectionality of poverty and sexism and racism and trauma have created an environment for these traffickers to easily identify their victims. Maryland is in the intersection of this issue. We have all the transportation thoroughfares going through our state. We have BWI Airport, we have the Port of Baltimore, we have Amtrak, we have I-95, and we have I-70. And they all conveniently converge into our hospitality district, the Block, the Convention Center, the ballparks, and the casino with hotels all around them. So what we would like to do is address this issue by understanding that Maryland is in a pivotal position to not only stop trafficking in Maryland, but throughout the country. So what this bill does very simply is it asks the Hotel and Motel Association to partner with us to provide free training to their employees within the first 90 days of employment around trafficking awareness, reporting, as well as providing records to the state's attorneys up to 18 months in order to gather guest room transactions that will help them with the evidence that they need to investigate, prosecute, and convict. Just to let you know, in the United States, our earliest statistics are from 2014, our most recent. Only 1,900 traffickers were investigated, and only 253 of them were prosecuted, and only 174 of them were convicted. So obviously there's a great need for this piece of legislation in terms of finding victims and getting them rescued and into treatment, as well as providing the evidence that we need to investigate, prosecute perpetrators. Thank you.
Thank you very much. All right, we're going next to Amanda Rodriguez.
Thank you, Madam Chair, Mr. Vice Chair, members of the committee. My name is Amanda Rodriguez. I'm the Executive Director of Turnaround. We are a comprehensive anti-trafficking agency. We also serve victims of sexual violence and domestic violence. We were the first comprehensive anti-trafficking agency in the state. We actually opened our doors to trafficking victims in 2011, and the agency itself has been around since 1978. I'm also testifying on behalf of the Baltimore County Human Trafficking Task Force, and I'm the legislative chair of the Maryland Human Trafficking Task Force, which I'm also testifying today. I've been working in this field for just over 15 years and have seen multiple cases of human trafficking that takes place at hotels. In fact, to Amy's point, the majority of those that have been identified as survivors in this state have been identified at a hotel or after being recovered from a hotel. Our hoteliers are really on the front lines of identification and can work hand in hand with other state authorities and victim service agencies like mine to make sure that survivors are in fact safe. There's a couple of cases that I'll mention just in terms of how this worked and didn't work. So up until this point, we have not had any type of mandated training or protocols, and there is a Baltimore County hotel that regularly partnered with law enforcement, were notified of what the risk factors were, and regularly notified law enforcement when they came across survivors of trafficking. Baltimore County has one of the highest rates of trafficking in the state. And I want to say of trafficking because we don't know how high this number goes, but we do know that they identify more and prosecute more cases historically than any other county. It means that there's people that are looking for the right things and are taking these cases seriously. The other one was actually a hotel situation in which the young woman, she was a child, she ran down to the front desk and claimed that she had been trafficked. She didn't use those words because survivors often don't know those words, but in fact gave identification clues. The front desk person did not know what to do with the situation. Ultimately, the child continued to be trafficked for a period of time before they were recovered. So the hotel absolutely can make a difference in terms of identification of these survivors. We are asking for a favorable report for SB 91. Thank you so much for your time.
Thank you. All right, we're going now to Stacey Clark Amparo.
Hello, good afternoon, everybody. I am from the State's Attorney's Office in Baltimore County. I'm an assistant state's attorney. Today, I am asking for a favorable report of Senate Bill 90. I've been the sole prosecutor handling both felony and misdemeanor trafficking cases in Baltimore County since 2015. Part of my duties have included directing investigations for these types of cases to ensure successful prosecution. We all know that these crimes tend to occur in secret in hotels and motels, easily evading detection. The victims of trafficking who have endured years of trauma are not often forthcoming with investigators about their trafficker's identity for fear of retaliation. One of the most valuable tools investigators possess are the hotel and motel records. And during the investigation stage of a trafficking case, invaluable information can be gathered from one page of hotel records. Other times, financial information can be subpoenaed from these records. The wealth of information that can be gained can be used as real-time leads for detectives when conducting surveillance. And of course, during the prosecution phase, survivors of trafficking come forward, proceed to trial. They're oftentimes deemed unworthy by their peers. However, hotel records can help corroborate the statements of survivors and lend them much needed credibility. Other times, survivors of trafficking may remember the room number of a specific hotel, as well as the dates of a hotel stay, and there is no more powerful evidence to show the hotel records to a jury with that same exact information a survivor is testifying about. Thank you, and I urge your favorable report of Senate Bill 90.
Thank you. Now, our last two oral witnesses are representing, I guess, hotel and lodging associations, and they are favorable with amendments. So we want to listen carefully to the amendments being proposed from the hotel industry. Let me call on next, Amy Rohr.
Good afternoon, Madam Chair and members of the committee. Thank you for the opportunity to testify today. For the record, my name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association. As Chair Kelly stated, we are favorable with amendments on SB 91. Certainly, human trafficking is a horrific crime, and it is one that the industry is tackling head on. There is a national No Room for Trafficking campaign, which provides a number of resources, including training, at no cost to hotels. And our organization is very much in support of everything that is promoted through the No Room for Trafficking campaign. The steps that are proposed in this bill are steps that many hotels in Maryland have already taken. And so we appreciate the bill's intent and the fact that the significant resources the industry has already put into tackling this issue would meet the requirements that are laid out here. Ari Ploud, our lobbyist, submitted amendments, and we are asking for consideration to address three things. The first would be an allowance of 90 days instead of 45 for new hires to receive the training. We are asking for that extra flexibility, especially in light of labor shortages, which would make it easier for the training to be provided during slower periods. And we also believe that it is beneficial for the training to be provided to an employee after they have a little bit of experience in a hotel to better understand and recognize what is normal activity versus what is not normal activity. Secondly, as far as procedures go, the most important call that a hotel needs to make if human trafficking is suspected is to law enforcement or to the National Human Trafficking Hotline. The bill indicates that an innkeeper should report potential instances of human trafficking to GOCAP, which we don't think is appropriate. And then third, it is absolutely important for an innkeeper to implement a policy to address suspected human trafficking, but with the many resources available, it is not necessary for them to develop one as stated in the bill. So we appreciate consideration of our proposed amendments and with them urge a favorable report. Thank you.
Okay. Let me just ask the sponsor, are you aware of these amendments and do you have copies of the proposed amendments?
Yes, Madam Chair. Thank you very much. Those are the amendments I mentioned during my presentation. So we are in agreement with that.
All right. And then our final witness is Ari Plott.
Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. I'm Ari Plott here on behalf of the Maryland Hotel Lodging Association in support of this bill with amendments. I want to thank Senator Jackson for sponsoring this legislation. As Ms. Rohr alluded to, I submitted my comments and the amendments as written testimony. And as Ms. Rohr explained, they're just minor tweaks. Our industry has been proactive in combating human trafficking. We do have existing policies to fight this. And we believe that having a uniform state law would be a positive in the direction that we want to go. So with that, I appreciate your time and ask for a favorable report. Thank you.
Thank you. Senator Klossmeyer has a question for you.
Thank you, Madam Chair. As being from Baltimore County, I just want to applaud Baltimore County. I did not realize that we had the highest rate, but for the Women's Commission and for Amanda and there's the other lady, just thank you for all you're doing for the state's attorney's office. And I agree with me, right, Madam Chair?
Thank you. Okay, that ends the testimony on this bill. And I'm glad we've got the amendments. Maybe we'll be able to move forward rightly on the bill. Thank you. And now we're going to Senate Bill 249, Senator Hayes, Baltimore City, cigarettes, other tobacco products, and electronic smoking devices, local laws authorization. And you have the time that you need, and then each of your witnesses will get 2 minutes each.
Thank you so much, Madam Chair and members of Senate Finance. It's a pleasure to speak with you today about Senate Bill 249. You've heard testimony on this bill in the past, but this year is a little bit different. In the past, this bill has been solely supported by the Baltimore City Health Department. This year, we enjoy the support of the Baltimore Mayor's Office as the single health policy priority of the City of Baltimore in this legislative session. And shortly, we'll hear from our Director of Government Relations for the Mayor's Office. Today, you will hear some added testimony with additional information in response to some of the concerns been raised in previous years from and also in opposition in previous years. So you'll hear some additional testimony to address those concerns as they will be raised again later on as folks testify. Therefore, this is the year where we hope this committee will consider passage of this legislation beyond a public hearing. As a point of historic note, the Baltimore City Health Department is the oldest continuously operating health department in the United States. In 1793, when the governor appointed the city's first health officers in response to yellow fever outbreak in the Fells Point community. Baltimore City has the highest prevalence of tobacco usage in Maryland. African Americans tend to smoke at a higher rate, linked to greater health disparities in our state. The density of tobacco retailers exacerbates disparate tobacco usage rates. 1,600 retailers operate in Baltimore City. It's one retailer per every 300 residents in the city. Senate Bill 249 will enable an effective and efficient response to tobacco retailer density and tobacco-related public health concerns in Baltimore City by proposing to allow Baltimore City, Mayor and City Council to enact and enforce local laws regarding smoking devices, cigarettes, and other tobacco products and electronic smoking devices in Baltimore City. Senate Bill 249 also makes an important exception, ensuring that Baltimore City Council and Mayor are not authorized to enact and enforce local legislation relating to licensing or the imposition of taxes of cigarettes. This legislation maintains that authority that rests with state government and the comptroller's office. Currently, Baltimore City is preempted from legislation in the aforementioned fields due to the Maryland Court of Appeals holding Altatus versus Prince George's County. Other jurisdictions, such as New York and Philadelphia, has passed legislation to prevent similar situations from arising because it inhibits effective and efficient control of tobacco retailer density, which is directly correlated to usage. Additionally, this bill will allow Baltimore City to enforce tobacco laws in tandem with the comptroller's office. This creates a meaningful opportunity for local government to reduce the burden of broad enforcement that currently falls upon the comptroller. Senate Bill 249 proposes to provide Baltimore City Council and the mayor with the authority proportional to public health hazard created by current rates of tobacco usage. Among Baltimore City residents with positive effects of the comptroller's office, as it will likely result. Committee members, you received a letter from the Baltimore City Solicitor's Office. There have been testimony provided to this committee in the past that the city already has the authority to impose such requirements. And so the city law department, we fell short to submit the testimony on behalf of our Baltimore City solicitor. And so we emailed directly to each of your offices a copy of our city solicitor, who is the top attorney, well-respected attorney throughout the nation on this issue. And it reads, Senate Bill 249 will operate to overturn the case of Altatus, United States, Inc. versus Prince George's County, Maryland, in Baltimore City only. The case struck down 2 Prince George's County ordinances concerning the packaging and sale and distribution of cigars. The Court of Appeals wrote, we shall hold the state law occupies the field of regulating the packaging and sale of tobacco products, including cigars, and thus preempts the 2 ordinances enacted by the Council of Prince George's County. The court determined that the General Assembly meant for section 16101 of the Business Regulation Article of Maryland Code to prevent local regulation of packaging and sale of tobacco products. Senate Bill 249 would give express permission to allow Baltimore City to regulate the packaging and sale of tobacco products locally. To be clear, the Altatus decision does not prevent local governments from regulating where people can smoke, criminal laws on sales to minors, or laws concerning product placement and advertising. Rather, the Altatus decision is limited to packaging and sale of tobacco products. It prevents the city from enforcing 2 subtitles of current Baltimore City Health Code, Subtitle 2, sale of cigarettes, and Subtitle 6, flavored tobacco wrappings of Title 12 of the Baltimore City Health Code. It also prevents the city from enacting additional laws on these topics. You will also have in your package testimony from WMD Car Services Station and Automotive Repairs. And the argument that they make is illegal sale of packs of cartons, OTP, and ESD are on the streets of Baltimore now with next to zero enforcement. And they almost make the argument for us. And they propose that this would only enhance illegal market. Currently, the state comptroller has only six enforcement officers for the entire state. Baltimore City Health Department has a dedicated staff that argument the comptroller is already stretched staff. Baltimore City Health Department staff already has the authority to issue environmental control board citations, with the exception of the city code in which we're preempted on these issues as it relates to cigarettes. Again, Baltimore City has the oldest department in this country, oldest health department in this country and has the capacity other jurisdictions in the state may not. And so we asked for this to save on state resources, to share the authority and enforcement with Baltimore City government. They work closely with the Baltimore City Police Department that serve as a force multiplier. Without legislation, they lack the authority to enforce these sections of existing city code. And so that flies against the testimony that has been provided in our package that it's already not enforced. The premium cigar retailers, they acknowledge taxation should remain exclusively as a matter of the state's purview, and they support that position, which this does not have any effect on taxation. That will remain in the state comptroller's office. However, they claim enabling jurisdictions to enact their own set of rules and regulations will lead to inconsistencies and redundancies in enforcement and will make compliance more difficult, costly, and burdensome. Baltimore City has always been a leader in the state of Maryland on the public health issues, not only being the oldest health department. More than several decades ago, Baltimore City Health Department led the way here in Maryland with needle exchange with the authorization from this General Assembly. Decades later, almost 20 years later, when overdoses in counties around Maryland began to share the experience of overdoses, hepatitis, and other things as it relates to dirty needles, other counties followed Baltimore City's lead that they established decades ago in doing this. And so we, as the oldest health organization, we've always been a leader in the state in providing, and this is solely a local bill. Also, the cigar retailers has said that this legislation will have the effect of driving business in Baltimore City across jurisdictional lines and will require people to travel further and spend more time in order to obtain the products they want. The cigar retailers in his opposition argue the exact reason why we introduced this legislation. I understand the industry prioritization of protecting their bottom line. We have chosen to prioritize the health of our citizens and give them the opportunity to debate the pros and cons of this policy at a local level with our mayor and city council, with our mayor and city government, which is more accessible to them. This is a local authorization bill. Traveling to Annapolis to weigh in on this legislation is a barrier to many city residents who depend on public transportation. And lastly, Royal Farms has submitted testimony saying that they're concerned this bill will reduce sales and force layoffs, again, prioritizing the bottom line. Banning tobacco products would stop and they doubt that banning tobacco products would stop or even reduce smoking. Walgreens, I will point out to this committee, has already for several years voluntarily stopped the sale of tobacco products and have not experienced any reduce in their workforce or the stores that they operate here in the state of Maryland or throughout the country. Colleagues, please note that the Baltimore City Senate delegation will vote on this legislation tomorrow. There's no doubt that this legislation will be supported unanimously, as it was last year. Once the vote is taken, the delegation position will be forwarded to this committee. Thus, I urge a favorable support in support of this local Baltimore City bill. Immediately following my testimony, barring no questions, although I see Senator Klossmeyer with a question with her hand raised, you'll hear from my panelists, Natasha Mayhew of the Mayor's Office of Government Relations, Celeste Davis from the Baltimore City Health Department, Beth Holler of the Baltimore City Health Department. Madam Chair and members of the committee, I thank you so much for the opportunity to testify to you this afternoon.
Thank you. And that hand went down, and we are waiting for the letter as soon as your delegation has voted on tomorrow so that we can bring it to consideration by the Finance Committee.
Yes, ma'am.
All right,
Thank you.
we're going next to Natasha Mayhew.
Good afternoon, Madam Chair, Vice Chair, members of the committee. Natasha Mayhew here on behalf of the Baltimore City administration in support of Senate Bill 249. And I do want to thank Senator Hayes for sponsoring this bill, for his continued efforts over a couple of years to help address this very important issue for Baltimore City. As he noted, this is the top health priority for for our administration. For years, the city has advocated in support of local regulation authority over these tobacco products. And as was noted, this was an authority the city and other jurisdictions had until the Altatus decision chilled local enforcement efforts and invalidated existing local laws. Our health department enforcement officers are the closest and most prepared for addressing those local complaints and violations of tobacco laws. As you will hear, the decision has hamstrung some such efforts and led to inconsistent enforcement and unresolved cases. For example, for the illegal tax stamps or sales of unpackaged cigarettes. Passing this bill will help us better address the health and welfare of our residents. And for that, we urge a favorable report on Senate Bill 249. Thank you.
Thank you. All right, we're going next to Celeste Davis.
Thank you, Madam Chair and Senator Hayes, and good afternoon to all the members of the Senate Finance Committee for allowing us the opportunity to speak today. My name is Celeste Davis, and I serve as the Chief Health Policy Officer for the Baltimore City Health Department, and I'm accompanied by our Deputy Commissioner, Mary Beth Haller. As Senator Hayes pointed out, our mission at the Health Department is to protect health, eliminate disparities, and enhance the well-being of everyone in our community. And we do that through education, coordination, advocacy, and direct service delivery. As a representative of the Baltimore City Administration, we support and respectfully request a favorable report on Senate Bill 249. There is a public health crisis in the city of Baltimore, and it's fueled by the availability of tobacco products and the prevalence of tobacco use. And this use is associated with some of the highest rates of morbidity and mortality. Accordingly, the Baltimore City Administration is requesting the ability to do more at the local level in coordination and consistent with the authority granted by state law to curb these alarming trends and improve the health of our residents. With more than 1,600 retail establishments licensed to sell tobacco products, Baltimore City has the largest number of licensed cigarette retailers of any jurisdiction in Maryland, and the prevalence of tobacco use in Baltimore City is one of the highest in the state. It is imperative that we as a city administration have access to legislative tools to address the health needs of our residents. Since our efforts in 2008, the Court of Appeals decision to preempt local laws has left us without the means to successfully address the health impact tobacco use has in our city. Currently, we are only able to address tobacco sales to minors, although we received several requests to investigate sales concerning illegal tax stamps and the sales of unpackaged cigarettes. With increased authority, the Baltimore City Administration will be able to address certain public safety issues surrounding the sale of tobacco products. In many of our documented cases, complaints regarding tobacco retailers also involve violence and criminal activity. The Baltimore City Administration welcomes the ability to coordinate with other local and state agencies, as would be authorized with the enactment of Senate Bill 249, to better address these situations as they arise, and ultimately to ease the concerns of our residents, creating a healthier, more vibrant city. We respectfully request a favorable report on Senate Bill 249. Thank you.
Thank you. All right, we're going next to Mary Beth Haller.
Thank you, Madam Chair.
You have 2 minutes.
Thank you, Madam Chair and members of the committee. I will not be offering separate testimony. However, I am here to support in addressing any questions.
Okay, are there any questions so far from the Baltimore City Administration and the Health Department? Okay, maybe some will come up. Thank you. Brooke Torton.
Thank you, Madam Chair, members of the committee. My name is Brooke Torton. I am the Managing Director of the Legal Resource Center for Public Health Policy at the University of Maryland School of Law. I'm here testifying today in my individual capacity. Though the committee has already heard from officials representing Baltimore City, I'm going to speak to the larger issue here, which is home rule power in Maryland. Our Constitution, unlike many other states, has allocated some autonomy to local governments. This has effectively permitted the counties in Baltimore City to enact and enforce local law for decades. Tobacco is simply one of many public health areas that Baltimore has been able previously to regulate. And so effectively, this court decision has plucked out tobacco out of a lengthy list of public health topics and said, no, locals, you may no longer enforce in this area. Just to name a few, Baltimore City and other jurisdictions already successfully regulate, and by the way, sometimes differently from one another. Things like health and safety at boating marinas, at pools and beaches, tanning facilities, tattoo and piercing parlors, and the list goes on. This court decision in 2013 was an attack on local home rule power. Tobacco was just cherry-picked out as one of the topics in the mix. We might hear from opposition over what this court decision actually did, but it is simply unavoidable to conclude that it has prevented locals in Baltimore City from enforcing the laws on their books. So how do we know that? One, Baltimore City has said it has laws on their books that they've no longer been able to enforce, and that's as a result of their advice from their Office of Law. Two, as a barred member of this state, I work with and speak with local health departments and county offices of law all across the state, and they have reached the same conclusion. Third, the Office of the Attorney General has previously submitted a letter of support indicating the same on a previous iteration of the bill in a prior year. I would ask this committee for a favorable report and to restore this authority to Baltimore City. Thank you.
Thank you. All right, we're going next to Matthew Boley.
Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. My name is Matthew Boley of Rifkin Weiner Livingston, here on behalf of the Premium Cigar Retailers Association of Maryland, which includes approximately 35 brick and mortar retail stores, retailers throughout the state. We are here in opposition today to SB 249. I will be brief and won't repeat my testimony, which you heard last week regarding SB 99, the statewide version of this legislation. However, I would like to quickly add a few points of emphasis. SB 249 would enable Baltimore City to regulate tobacco products at the local level, which would have the effect of driving business across the city line into neighboring jurisdictions, forcing people to move further and spend more time to obtain the products that they desire. We oppose a patchwork approach to regulation of tobacco products. And again, as it pertains specifically to premium cigars and pipe tobacco, youth are not allowed in premium cigar stores. These stores do not sell products that they want. As a result, we do not believe we should be included in this legislation, and we ask for an unfavorable report.
Thank you. Next, we'll hear from Stephen Castro.
Madam Chair, members of the committee, my name is Steve Castro. I'm here again representing the over 35 mom and pop premium cigar retail shops throughout the entire state of Maryland. I'm the owner of Davida Cigars, the largest chain of premium cigar stores in the state, only in the state of Maryland, with 12 stores in 8 different counties, including Baltimore City. As I said last week, you all know it's been incredibly difficult to survive and stay in business over the past 2 years, especially in Baltimore City. My store in Baltimore has been brutally robbed and vandalized 3 times in the past 2 years. And if this bill goes into effect, it will give me one more reason to get out of the city. I know our customers would be very, very upset if this happens. We sell premium cigars and pipe tobacco, a luxury, expensive product to adult customers. The Food and Drug Administration acknowledges premium cigars and pipes have a negligible impact on youth tobacco consumption. The FDA's own enforcement data shows that specialty retail stores like mine are the most certain way to assure legal adult sales for any type of tobacco product. We are not the problem. With stores across the state, SB 249 would make it extremely difficult to comply with very different and overlapping sets of rules and regulations. I saw this happen over and over again during the COVID shutdown, when Maryland completely shut me down and my customers drove to Virginia to get their products. When one county would close us down, customers go to other counties or back to Virginia. People will travel to other counties or out of the state if there is something they want. We saw this happen over and over again the past 2 years. If this bill goes into effect, it will badly hurt my company and force me to close stores, causing job losses in the more restrictive municipalities. I urge the committee to keep control at the state level and not give up your decision-making power to the counties. Please give an unfavorable report to Senate Bill 249. Thank you for your time.
Thank you. All right, Shelby Kent is next, and you have 2 minutes.
Good afternoon, Madam Chair and members of the Senate Finance Committee. Thank you for the opportunity to testify in regards to Senate Bill 249. My name is Shelby Kemp, and I'm a marketing manager for Royal Farms Convenience Stores. We are a third-generation, family-owned, Maryland-based business, and our headquarters is located in Baltimore City. We proudly operate 160 stores and employ over 3,000 employees in the state of Maryland. 27 of those 167 Maryland stores are in Baltimore City. We are, and we've always been, committed to serving the people of Baltimore. I appreciate Senator Hayes' comments regarding Walgreens not laying off any employees. However, the truth is that we are in completely different industries. Cigarettes and other tobacco products do make up a significant percentage of our sales in our stores. If Senate Bill 249 were to pass, the revenues in our stores would substantially decrease, and there is definitely a chance that we would have to lay off employees that work in Baltimore City. From a state policy perspective, we seriously doubt banning tobacco products would even stop or reduce smoking. People who smoke would simply find another market nearby to buy their tobacco. We do request an unfavorable report on this Senate Bill 249. Thank you.
Thank you. Next, we'll hear from Bruce Bariano. You have 2 minutes.
Good afternoon, Madam Chair and members of the Senate Finance Committee. For the record, Bruce Bariano, here on behalf of the candy and tobacco wholesalers, in very strong opposition to this bill. You've really received a lot of very erroneous information from the proponents on this bill. This bill is intended to give local governments the authority to ban the sale of tobacco products. Flavored tobacco, increase the ages, require location of the products in places where customers can't see it. This bill is not just an enforcement bill. It's a bill that will allow the local governments to enact additional laws. Now, the problem with this is that the state legislature, you all respectfully as legislators, have very heavily taxed tobacco and tobacco products for the revenues for good purposes that they've used it at the state level. Well, that is why the court decisions have said that you have occupied the field of taxing and regulating the sale in order to preserve the prerogative for the state to tax the product. If the local governments are able to regulate by passing laws, which this bill would allow, the sale of these products locally, you're going to interfere with the collection of taxes at the state level. This Alditas case is not the only case on this. In a case that I argued in the Court of Appeals in 1992, Allied Vending versus the City of Bowie, the Court of Appeals said the exact same thing that they said in 2013. So the local governments have never, ever had this authority to legislate on the sale of the product. Never. So it was never taken away from them. They never had it. And the case in 1992 and the case in 2013 made that very, very clear. I have no problem with Baltimore City wanting to increase enforcement of laws that are improper. But these local laws, please, members of the legislature, don't be beguiled. These laws would give local governments the authority to enact laws, and they're not going to enact laws favorable to tobacco. They're going to enact laws to ban flavored tobacco, menthol, etc. And that's going to affect taxes. And you state legislators are going to have to deal with the consequences of having less money. I know it's a flush year now, but it's not always going to be flush in that regard. So this is not a very simple bill. It's a bill of tremendous complexity that impacts state revenues. Thank you very much. I urge an unfavorable report.
Thank you. Next, we'll hear from Sara Price. You have 2 minutes.
Thank you, Madam Chair. Good afternoon, honorable members of the committee. My name is Sara Price, and I'm here on behalf of the Maryland Retailers Association in opposition to SB 249. We have opposed this in previous years, and we continue to do so because we just do not think that it is appropriate for local jurisdictions to create their own laws on this matter. Tobacco regulation should remain at the state level. We understand the desire to be able to respond locally to bad actors who are operating illegally, but we have serious concerns about the overall impact that this could have on the business community. As we've shared with you before, multi-jurisdictional businesses struggle when they're forced to operate under a patchwork of local laws, particularly in cities. Our membership has been impacted by this many times over with the passing of local environmental rules and most recently with local COVID-19 regulations as businesses struggle to get clear information about borders and zip codes in an effort to determine whether they actually fall within the geographic limits of local rules. As I mentioned last week, local authorization also unfairly impacts competition in the market. The fiscal analysis predicts that this bill could have a meaningful impact on small businesses, and we've seen time and time again, both in Maryland and across the country, that restrictive local laws result in lost revenue through border bleed sales, as consenting adults will be driven across city, county, and state lines to purchase the products that they want. The sponsor openly referred to this impact and did not deny that it will occur. Respectfully, the example that he gave of one large retail chain not losing revenue due to an internal policy change does not represent the realities of the industry, and especially that of small independently owned businesses that would be impacted by this. Additionally, I would note that local governments have adapted to the pandemic, and the format of this hearing right now shows that it is possible to conduct public hearings in an equitable manner, allowing individuals from anywhere in the state to testify without having to travel to Annapolis.
You have gone over your time.
I apologize. We would urge an unfavorable report. Thank you.
Thank you. You'll hear next from Kirk McCauley.
Chair Kelly, members of the Finance Committee, my name is Kirk McCauley, and I work for WMDA, and we represent service stations and convenience stores in Baltimore City and the state. I've submitted my written testimony. It's pretty comprehensive as far as the illegal sales go, so I'll be short. But giving Baltimore City or any city or county the authorities to control tobacco, OTP, or ESD products would have a negative impact on youth enforcement. When these markets are shut down, flavors are banned, along them lines, the illegal markets open up everywhere. Right now, we have an illegal market in Baltimore, as we do in a lot of large cities in Maryland. It's too easy. You can go to Virginia and buy 5 cartons and legally bring them back into Maryland. The tax difference is $30 a carton. There's too much money to be made for it not to be out there in the streets. If this bill were to pass, if flavors were banned, I have stores in Baltimore City where 58% of their sales are menthol. Now, you can ban menthol, but you're not going to stop people from smoking menthol because they're going to be opening up markets all over the city with little or no enforcement. They don't enforce anything now. They're not going to enforce it. They have too many other larger problems, as all the big cities. I'm not picking on Baltimore. It's all the cities are the same. But crime in illegal markets will explode. And along with maybe some of our retailers going out of business. Because in some cases, 25 to 30% of their profits right now are in tobacco, and probably larger in some locations. It's not a good thing. It'd be bad for retailers. It'd be bad for youth because they're going to be able to buy anywhere without showing ID. People don't care. They'll sell them anything. And God knows what else they'll sell besides tobacco. But it's bad for the state. The tax, I think Bruce brought up that the tax is gone. So I urge an unfavorable report. Like I say, my written's turned in. I'd be happy to answer any questions. And thank you.
Thank you. We're going next to Debbie Robbins.
Madam Chair and members of the committee, my name is Deborah Robbins. I'm the president of Century Distributors. As I'm repeating again from last week, SB 249 has a direct impact on our business and the retailers we service in each of the counties and cities, including Baltimore City. The decline in family businesses and the struggle that we face to remain viable in the state is a direct impact on the shifting of laws in the state. Tobacco is a legal product, including menthol and flavored tobacco. Not to continue to repeat the things that Steve Castro, Shelby Kent, Kirk McCauley, and Sarah Price and Bruce Bariano have said, but this has a major impact on us, and I completely agree with all their testimony. As I spoke last week, we need to look no further than Massachusetts to see prohibition and bans are bad policy. When Massachusetts passed their flavor bans at the state level, tax stamp data shows that 90% of all flavored cigarette volume simply shifted to surrounding states. So the sales will leave Baltimore City, but everywhere surrounding is only going to gain. Local patchwork of regulations create overdue complexities and burdens the retail universe. Allowing local control of tobacco products puts state coffers at risk from the vital excise taxes funding and instead sends the money to neighboring states, which are very short drives away. It is inevitable that if SB 249 is passed, other localities will want to impose restrictions and the same bans. The only winners will be the jurisdictions who don't implement a ban. Again, get the facts on Massachusetts and how the surrounding states have been the winners. If Bill SB 249 is passed, the surrounding areas will be winners, and this will only enhance more illegal selling of these banned items in the parking lots of Baltimore City. This will be truly the wild, wild west of Newport cigarettes, Juul menthol, etc., and flavors. Take a tour when you have time and see what's already happening in these parking lots. All this ban is going to do is increase illegal activity. I urge you to do an unfavorable report. Thank you.
Thank you. We'll go next to Fred Parsons, Jr.
Thank you, Chair Kelly and the committee members. My name is Fred Parsons. I'm with the George Falter Company. I'm a co-owner of the business. As we talked about last week, there should be no local laws regarding tobacco and vape. The state already has the laws. It will create more confusion amongst the retail distributors and enforcement. We already have an example of that in Montgomery County with the vape products. There is no one to contact to clarify the rules or to enforce the rules in Montgomery County. At least I have not been able to find them or get them to respond to my calls. There are no clear city-county boundaries around the city to determine for a person to know where they're shopping or to seek their products. I would please hope that you would have an unfavorable report.
Thank you. We'll hear next from Mike O'Halloran.
Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the Senate Finance Committee. It's good to be with you today. For the record, my name is Mike O'Halloran, here today in opposition to SB 249 on behalf of MDPHA, whose members own and operate gas stations and convenience stores throughout Maryland, including Baltimore City. Look, it's well documented, as certainly a lot of folks have testified today about the negative impacts that the COVID pandemic has had on Marylanders, whether it's their physical health or mental well-being, not least of which is the local economies, not just our state economy. As Bruce pointed out, certainly the state may be flush right now, and that's for a variety of factors, but our local economies are certainly struggling. Our operators are still weathering this fragile recovery. So the concern with SB 249 is the owners of these convenience stores located in the city will see less foot traffic in their stores, because in all likelihood, the bill will lead to bans or other restrictions of these products. That puts them at a competitive disadvantage to their neighbors, not unlike the statewide bill would have. I don't think anyone wants to see the creation of a black market, which this in all likelihood would do. That would create more problems than what the proponents hope this bill would solve, I would imagine. So I appreciate the committee's time. I appreciate the sponsors' intent, but unfortunately, we do request an unfavorable report for SB 249. Thank you.
Thank you. Brianna Brown is the next witness, and you have 2 minutes.
Yes, ma'am. Thank you, Madam Chair and the committee. Thanks for the opportunity to speak again. For the record, my name is Brianna Brown. I am the public relations representative for Royal Farms Convenience Stores. As you all know, we proudly operate in Baltimore City, but we're also headquartered here as well. We like to strongly oppose this bill. This bill has the potential to create adverse confusion, not only to our patrons, but to our employees as well. So this is going to pose a great threat to our inventory and ordering systems that will take a great deal of training and certification to ensure that our employees are aware of the changes and the potential consequences of incorrect pricing. Purchasing and maintaining the supply would be far less predictable, making this a logistical nightmare. We also take pride in our role as a consistent and a reliable entity for the communities in which we serve. We are a 24-hour-a-day operation, and families rely on us to supply them with food, fuel, over-the-counter medicines, and much more. If the tobacco sales decrease, we may be forced to restructure and lay off our employees. This action could result in an untimely store closure, which would affect the city's revenue. Like I said before, we are headquartered here and remain committed to Baltimore, and it's disheartening that legislation could potentially force us to close stores and lay off employees. Excuse me. It is not our belief that this bill will prevent the use or reduce the sale of tobacco. Rather, patrons will find a way. They'll travel further or create a black market to simply secure what used to be so easily accessible. We seek an unfavorable vote, and I thank you for your time and consideration.
Thank you. And next is Scott Weber. You have 2 minutes.
Thank you, Madam Chair and members of the Finance Committee. My name is Scott Weber. I am with the Vaping Awareness and Public Education Society. We're a nonprofit public health advocacy organization dedicated to fighting cigarette addiction. We sincerely appreciate the intent of this bill. It is an attempt to reduce the harm of tobacco-related death, disease, and cost. And for that end goal, we are on the same team. But this bill is being created in its big cousin, SB 99, is nothing less than actual legal and regulatory anarchy. This bill authorizes essentially limitless regulation by means of definitional abstraction and obscurity that has very little recognizable relation to state law. A bill will be almost impossible to track, impossible to enforce, because it's impossible to even define. My brief written testimony focuses on the completely undefined definition of stringent, which is tight or constricted. It has rigor or strictness, especially in regard to rule. So for a local law to be given legal authority to be at least as stringent as means that it has to comply with at least strictly as the original law to which it is referring. And any law that is less stringent than the actual law is by definition in violation of the law because it's not following the letter of the law. On the other side of that, being more stringent than the actual law to which it's being compared can only reach the point where it's more rigorous in adherence and more tightly in conformance to the original law than the original law itself, which is the linguistic and legalistic impossibility, because once you get to full 100% conformity, you cannot become any more stringent, lest you now start deviating from the original law, which is exactly the opposite of being stringent and becomes unlawful. There essentially is no definition of stringent in tobacco regulation or anywhere. And the Aldatis case is a perfect example. To them, the stringent meant you had to serve bigger packages, but does that mean that they could set a minimum of 6 cartons per purchase? Or does it mean they have to be smaller packages? There's no definition of stringent. It's going to create chaos and essentially anarchy with an unlimited number of regulations coming from anybody's definition. I strongly request an unfavorable report from the committee. Thank you.
Thank you very much. That ends the testimony on this bill. Now, we won't be voting today on anything that we've heard today, but we do need to vote, committee members. So I need you to get to the committee room as soon as possible. There are
Madam Chair.
Oh, I'm sorry. I do see your hand, Senator Kramer.
Yes, and I know you are very anxious to get to the voting session, but, and I apologize, I had to jump out to go to judicial proceedings before the bill sponsor had concluded his introduction of the bill. But just a couple of quick questions for the bill sponsor. Bill sponsor, if I may.
Yes, sir.
Look, we heard quite a bit about this is a legal and a legal product. Would you agree with me that it is a legal product, albeit a highly addictive legal product that unequivocally causes lung cancer, heart disease, and a myriad of other chronic health issues? Would you agree with that statement?
Absolutely. And I would also say that the cost to our health systems are even greater exponential as a result of these legal products.
Exceedingly costly to our health systems. Would you agree that in Baltimore, your residents are disproportionately impacted and targeted by the cigarette industry and the vaping industry? Would you agree with that statement?
Absolutely.
Would you also agree with me that if, for instance, the city of Baltimore, with its elected council and its elected mayor, were to choose to, under one of the scenarios we heard just now, place these tobacco products behind the counter instead of right up front where people can easily see them or whatever, would you agree with me? Baltimore City, to choose to do that it would have absolutely no effect or impact on, for instance, Senator Klausmeyer in Baltimore County, or Senator Hershey on the Eastern Shore, or Senator Augustine in Prince George's County. It would have no effect on them whatsoever. It would simply be Baltimore City's elected officials determining what they deem is in the best interest of their residents. Would you agree with that statement?
Absolutely. The only thing that I would add, Senator Kramer, is will also afford citizens of Baltimore City to have a public hearing. This legislation simply authorizes the city government to pass laws. There's also another step that would have to be accomplished in convincing those who are elected city representatives to pass these laws. And so much of the testimony was a little bit misleading in what authority this legislation had.
Great. Thank you very much for that, Madam Chair. Thank you, Mr. Speaker.
Thank you. If there are no other questions, then I'm going to ask committee members to get to the hearing room as soon as possible. We've got 9 bills to consider for voting, and we want to give adequate consideration to each one and not to be here until